Did you read this article? Chicago Tribune. First of all, the very way they cover it, to receive controversial medication. Ivermectin has been used for decades with millions of people. It's about as safe a drug as exists in the world. Controversial? Some people were hurt when they used a form of it for horses? Oh, am I supposed to crack up? Is that a joke? Large doses can be fatal. Large doses of what cannot be fatal? Large doses of aspirin can be fatal. You know how many Americans died because of the FDA opposition and the CDC opposition to ivermectin and hydroxychloroquine and zinc? There are epidemiologists who believe most of those who died would have lived had they been given these simple, safe drugs. This is the age of the irrational, led by the media, the despicable, lying, fraudulent media, who are killers, absolute killers, in aiding and abetting this medical fraud. Another federal agency, the National Institutes of Health, has taken a more measured stance, saying that while the drug is well tolerated when used for its intended purposes, there isn't enough information to allow a recommendation for or against using it to treat COVID-19. Wait, so it's well tolerated. So if it's well tolerated, what's the risk? Wait, it's well tolerated if you have a lupus, but it's not well tolerated if you have COVID? Elmhurst Hospital's attorney, Joseph Monahan, said at the hearing none of its doctors would agree to administer ivermectin for COVID-19. Now, you know why I have contempt for the medical profession? That is example 56. The percentage of doctors who were fools is so large that it is painful to me. Painful. I was not aware of it. I was not aware of it. It's so sad. It is such sad news. Not one doctor in the hospital would administer to a comatose COVID patient on a ventilator. The ventilator is safe. You hear? This is safe. The ventilator, the kiss of death ventilator is safe, but ivermectin isn't. An internal ethics panel concluded its use could not be justified. Are you listening to this? Elmhurst Hospital's internal ethics panel concluded its use could not be justified on a comatose COVID ventilated patient. He argued that judges should not overrule medical decisions. Oh, God forbid. The court doesn't have the authority to order a medical corporation to use particular medications, particularly when it's an off-label use, particularly when the federal government has said it could be dangerous. Whoa. Judge James Orrell pointed to an affidavit from Phipe's physician, Phipe again is the woman who's comatose, Dr. William Crevier of Orland Park, in which the doctor said he has used the drug successfully for COVID-19 patients since last year. If Elmhurst doctors don't want to use ivermectin, the judge said, they should allow Crevier to administer it. Right? Why is that doctor less holy than the hospital's doctors, who are cowards? Why wouldn't this be tried if she's not improving? The judge said. Yes. Why wouldn't we try the ivermectin? So masks after vaccine outside should be worn, but ivermectin on a patient on a ventilator should not be used. This is the sick world induced by the medical profession that has lost its soul.